Okay.
Hello, this is Cameron Sabat, and today we are here with Mr. Bruce Broussard. Born in Hamilton, New York, he is an American business executive best known for serving as president and CEO of Humana, Incorporated from 2013 to 2024. Raised largely in Houston, Texas, he earned a BBA in finance and accounting from Texas A&M University, an MBA in finance from the University of Houston, and is a certified public accountant. Broussard built his career in healthcare finance and leadership, holding senior roles at Sun Healthcare, Regency Health Services, and Harvard Dental before becoming CEO of US Oncology, which was later acquired by McKesson. At Humana, he spearheaded the company's transformation into an integrated healthcare organization, significantly growing revenue, membership, and Medicare Advantage offerings. Known for his focus on quality, cost efficiency, and member experience, he also served on boards including HP Incorporated and America's Health Insurance Plans. After stepping down as CEO in 2024, he joined Define Ventures as a venture partner, continuing to shape the future of healthcare innovation. Thank you so much for joining us today.
Well, Cameron, it's great to be here.
Yes, absolutely. What an honor. And thank you for joining. So I wanted to start out with um, a big question, which is what do you see as the most important policy changes needed in the next decade to strengthen the US healthcare system?
Yeah. Well, maybe before we do that, just put some context because I think it'll lead through many different questions you asked. And that is really around my view on the healthcare system and frankly, the food system in our country, which greatly impacts the health of our individuals. And it's been built around a consumption model. And that at its premise is really one of the difficulties we have. And why it is because it really isn't focused on health. It's not focused on prevention. It's much more reactive, much more transactional oriented, and therefore we get what we pay for, so to speak, and that is a lot of volume, a lot of focus on utilization and selling food as opposed to what is best for the health of our country. And I think that's at the heart of what the American society deals with. And so when I think about the policies, the public policy side of it, and I think about what are the larger impact of it, I think one thing that's very important is to continue to move to where there is accountability in the system where people are our organizations are paid for outcomes that are both quality oriented and then also cost effective. And I know this is easy to say, but hard to do. And I appreciate that being, in healthcare for all the years I've been in it, but it can be done. I'd say the second thing that is related to that is bringing this not only about value-based payment model, but transparency. And I think the PBM model of today that has been part of our country, the pharmacy benefit management side, needs to continue to bring more transparency to pricing. And I think there's a lot of people that are in belief of that, but this transparency of pricing, not only with PBMs, but also what you pay
Mhm.
when you look the ability to see what one hospital is charging versus another hospital and be able to make a very informed decision. And today it's hard for the patient to understand that. If you were to go buy anything in retail, you have a lot of ways to compare. And today we don't have that opportunity. And I think employers and individuals need to have that transparency. I think the PBM model is an example of that, but there's many other models of that. And our pricing mechanisms in healthcare are very confusing and very hard to understand. The third area I would highlight is flow of and velocity of information. When you look at the banking system today and our financial systems in general, the of information, both in speed and in amount, is very high. And healthcare has not had that because the systems have been very fragmented. There hasn't been a call for universal, transition, transformation, trans sharing of information, excuse me. And the ability to do that through an interoperable way is critical. And I think, the various different administrations have pushed policy around this. I continue to see it being pushed. The technology has come a long way through API, especially the Fire API, and I do believe that's an area where will help greatly in pricing. It'll help greatly in payment model. Um, Ability to take risk because the sharing of the information allows people to make much more informed decisions. So just to maybe summarize that a little bit, I said a lot is first, I think the industry's fundamental issue, it's a consumption-based model. I think being able to put accountability into the system around downstream cost and prevention-oriented mindset. I think the ability to do that through a payment models that really reward for cost and efficiency along with quality. I think the transparency, the ability to bring better pricing, and then the third, I think the flow of information within our system can very much improve the ability to make informed decisions, both from a patient point of view and from a clinician point of view.
Absolutely. Um, I did want to, I have a series of kind of approved questions, but I did want to
Yeah.
kind of just harp on a few of those points that you made, and
Sure,
hopefully I
this
can
would be great.
keep in the realm
Yeah,
of
of course. Yeah,
acceptability. So when you mention price mechanism transparency, I actually recently spoke a few days ago with Mark Cuban,
oh yeah, yeah, yeah,
on
yeah,
this
yeah,
podcast,
yeah,
and
yeah,
he's mentioning the same thing, which was price transparency. I
yeah,
was wondering, as a fellow kind of executive in this space, what are the main things hindering other companies from following in cost plus drugs footsteps when it seems that they've been able to enter the industry and enact all these changes very radically and quickly? And then feel
yeah,
free to answer any part of this question or anything if there's any concern.
yeah. Yeah, I the it's really the business models that have gotten the industry to where they are today, and the rebate side of it, where pharmaceutical companies will provide rebates to people that basically the more you sell, the more rebates you get, mentality. And those rebates, the company holds some. They do pass on to the employers. Some I don't know, and it depends on the circumstances how much. But it's hard to understand how much is getting back from the pharma company to the company to what ultimately gets to the paying customer, whether it's the employer or the person at the counter. And so people like Mark have created a transparent model. At Humana, we were forced to do this in Medicare Advantage, is that we were forced to put the rebates back to into our cost, and reducing our cost. So in the Medicare system and Part D and Medicare Advantage, they already have that. It's the employer side and the commercial side where it becomes harder. So to answer your question directly, it's just an inherent business model, and the profitability impact of that could, depending on who it is and where and what customer, could have significant impact there.
Sure, sure. Customers definitely have a huge voice in this. I was wondering,
Mhm.
speaking of which, so I asked a lot of the corporate executives, what model do you prefer the most? Just personally or just philosophically?
Yeah,
CEO of Kaiser Permanente said capitation with risk adjustments. We have
yeah,
other people.
yeah,
The CEO of Kaiser Permanente was also on this podcast and mentioned that. So,
yeah,
you know.
yeah. I would, for me personally, both morally and in addition, from a point of view of incentives to do the right thing. I think the ability to hold individuals accountable or companies accountable for downstream costs, and this is what he refers to as capitated. I think you can do that in many different ways. I think in specialty, it's hard to do capitation, um, but there's a way to be able to reward for outcomes, and you could do that from a quality indicator point of view from a cost point of view. But I do think the ability to hold people accountable for downstream cost and what decisions they're making, I think is important. And I just feel the ability to do this, you could do it in a full risk model, like the primary care model that is out there today. You could do it in a bundled way that like an orthopedic surgeon has in their particular surgeries. Or you could do it in a way, then take oncology, for example, where, what's the appropriate measurement for palliative care and hospice? Um, and so I think if we studied it hard enough, and if the industry really was behind payment models that were accountable, you could figure this out.
Mhm.
I always use this example, and I think it's a potent example around safety. Years long before you were born, probably the seatbelt was not mandatory, and safety was of a car was a byproduct. It was used as a vehicle of transportation, which it still is today. But the industry was really pushed for safety as a result of the federal government. And there are some very big advocates around safety. You look at today, safety is an integral part of the car. The seatbelt is not only the case, we have all kinds of devices that tell us about, the car stopping in front of us, to the lanes, if you're going to turn and move into another lane, you have beepers that tell you about there's a car there, the way the car is made. I say that because it was a philosophy that was put into place into automobiles. It was a regulatory philosophy. It was a philosophy around the public side of it. It was educated from the public point of view. It was penalties were put in, requirements were put in relative to how things are constructed, and in addition, there was penalties put there, so and incentives. So I say that because I do think if we as a healthcare system and the ultimately the government said we are going to be preventative oriented, which includes us being very oriented to outcomes, I think you could get there. It won't be tomorrow, but it's a philosophy that has to be embraced today. And today, that embracement isn't 100%. It's sort of halfway. You have, a few people that are leading it. Your point of it, the CEO, Greg, is a great example of that. But you need a much broader push, and I think this is an area where we can create what is the philosophy of healthcare. It's prevention.
Sure, sure. And then along the lines of prevention, earlier this conversation you were mentioning the ideas of healthcare as a consumption-based model. And along those lines, I was wondering about equity and access and outcomes.
Mhm.
That remains a challenge nationwide. What types of policy approaches have the strongest evidence for impact? And where do you think future leaders, many of whom are watching this podcast,
Yeah.
focus their efforts?
Yeah, I would say that the ability to incorporate incentives or penalties around subpopulations in specific areas where you see there are higher incidents in those populations. Heart attacks in African Americans are a great example of that, or diabetes for that matter. And the ability to reward or incentivize or penalize based on the outcomes of that population for particular physicians. And I just feel, and I would probably pick the incentives to encourage people to really seek out those populations to treat and measure it. I mean, we have a wonderful measurement process around HEDIS and be able to measure whether it's heart attacks per thousands for those populations to diabetes, maintaining diabetes and other things like that. I just feel putting quality scores with reward for better quality, I think is the way that you can really get people to orient to these subpopulations. And if it's a big enough number, I think people will seek out being able to support them.
Sure, sure. And this definitely sounds particularly appropriate for primary care. I've
Mhm.
waded deep into the waters of I helped develop with the head of breast surgery at UPenn the first surgical oncology VBC model, and we got a lot of
Mm.
pushback for that because as you know, surgical oncology, you go in there and it's just a mess all of a sudden. So you
Right,
don't know, and it's hard to risk stratify as
right,
compared to primary care when it's a little bit
right.
more straightforward. I'm wondering if there are any other kind of hidden roadblocks that if people start wading into these waters, they might find out.
Well, there'll be a number of roadblocks all the way through what is the benchmark, what are other aspects related to that. And I do think, one of the areas where I do believe is that you can walk into this, but I do think when you take the stratification and you do it at a large enough population, you're going to get a reasonable estimate of what the target should be. And I just feel we have massive amount of information around people's health and sickness, and being able to set those benchmarks, we can do this. It's to me, to be honest with you, it's a question of philosophy. Is that there is more fight around we're going to keep the system as it is today, as opposed to the push of moving it to an accountable system. I think once you make the ability to push it to the accountable system, you will find the benchmarks to be able to establish.
Wow, that's really inspiring. And along those lines of accountability and looking forward, as you know, home and community health based care are expanding. Do you see
Mhm.
these models as a future of healthcare delivery? And, if so, what policy guardrails are needed to ensure quality and sustainability?
Yeah, I would say home is an area where I have a lot of passion around because it is convenient. It is a place where you see so much when you go into the home relative to people's care, how they live. If the house is really crowded, or where their drugs are located, or where their drugs aren't located. To do they have pets and all, is it clean? All the things that you can really, take in about somebody's lifestyle and frankly their health. Are they lonely or not is a big indicator of that. So I do believe home is not only a place of convenience, but it's quite a place of insight around someone's health. So I think it is an area where there's all kinds of tailwinds relative to pushing more care there. I think the acknowledgement of it, I think the technology, whether it's telehealth to the digital devices that are coming out, to the ability to really reward people for going into the home. And I think especially for the under-resourced populations where mobility is harder, whether it's an elderly population or a population that does not have the mobility. So I think it is a very important area for us to progress on. I think rewarding beyond episodic care today, I think, is an important part of that policy, and the area where you reward for, again, I get back to quality outcomes along with the cost. And I think rewarding more for people to do in the home, because right now it's, come to my office kind of thing. But I think if you were able to reward people for really going to the home, whether it's through a telehealth means or an assisted, someone going out there and being able to work with the patient, um, and the doctor being on via telehealth, is a good example where I think incentives could really push more people into the home and pay more for that, as opposed to making it more episodic kind of activity. I think the area around what are the clinical modalities that you want to do in the home would be an important decision. I know there's a lot of, discussion and work going on the ICU at home, and that's a little harder, I think, because of the infrastructure you got to put at home and the immediate response there. And I'd sit there and say, that's something probably surgery, obviously, not at home and those kind of things. And so I would put a box around what would you develop that would be a home care model that you would use professional and payments and other things to incentivize people to go into the home. But who does the care is an important part of that.
Who does the care? And that actually ties right into the questions of AI and how digital health really fits into this whole constellation.
Yeah,
These are radically reshaping care delivery, and some may argue not as much as it will be in the future.
yeah,
Policy perspective, though, what opportunities should early career leaders be looking for?
yeah. Just to put some context around your point around AI being a a real great enabler of for healthcare is, I just want to maybe put where. I would say first, just the ability for AI to process unstructured data is very powerful. I think that's an important part of that. And then to be able to bring that unstructured data with context, to be able to summarize it and then put context around what that summarization means, and then be able to utilize that as a intelligence in helping clinicians make decisions, not to make the decision. I want to emphasize, being a co-pilot versus being the pilot, so to speak, is an important part of that. And then the, recent developments around agenics and the ability to use agents to create, workflow automation that makes it easier. Um, and then be able to, clinically uh, analyze and understand the outcomes, I think are important. And so I look at it having impact in research and the ability to just process a lot of information, be able to do it in a way that summarizes it and gives a really thoughtful view. And you merge that with some of the genetic work that's going on and all the other, pharma areas where that's advancing, is very powerful. And then I look at the workflow, and you think about 60% of your time as a clinician is being used on administrative matters. A lot of that can be eliminated. And I look at, the ability to then utilize individuals like yourself in a much more productive fashion. And then the third thing is to reduce the friction in the system that is so makes it so complicated and make it simpler for people to use the system through doing a lot of these the questions that are hard to ask, to answer those questions very easily on behalf of the individuals and eliminate things like pre-authorization and other things that can become much more around an analytical framework as opposed to individuals becoming very frustrated.
Absolutely. And just two final questions.
Mhm.
I do want to be mindful of your time here as well. So when you mentioned, and feel free to answer or not, when you mention the ability to kind of move through rote tasks, I agree. Do you, how do you think the role of primary care physicians fits into the future, given the advancements with AI and NPs and PAs assuming more responsibility? I'm sure you're well aware of these developments, and everyone is.
Yeah.
Very curious to
Yeah.
hear your thoughts.
I think primary care is actually an exciting field as a result of having the support from the various different both specialties, but also AI and the ability to utilize, some of the knowledge that comes from that. I saw a an investment thesis just a few weeks ago around investing in these basically AI agents that had a specialty of different specialties within healthcare that would help biotech companies be able to analyze research. And so what they're doing is they're taking the brains of, specialists and creating AI agents out of them that you would call one, a particular specialty, another is particular specialty, and a third. So there'd be different models, but become really thoughtful around the knowledge of that
Mhm.
and then be able to utilize that in the research side. But I say that because that's an example where you're utilizing a very specific and technical information to make a generalist better. And I do think they will never be able to do surgery. They'll never be able to do the various different things that are required as a specialist. But to be able to help understand what's going on and make the referral the appropriate area. So I see AI being supportive of primary care and making them much more able to practice at the top of their license, as it will with physician assistants, as it will with nurses and so on. But I think this ability to create this expertise that's accessible by a broader audience, I think will continue to be the case, whether it's in healthcare to the way it's in science, to the way whether it's in financial, the financial systems that we have today. I think it will be broadened, always with some co-pilot involved as whatever the final decisions are. But I think it will make individuals much better clinicians, especially primary care.
It's empowering, yeah. It
Yeah,
really flips the script because a lot of the doctors that I speak with, or at least medical students, are very concerned about it. They don't know
yeah,
it's a black box.
yeah,
You know,
yeah.
Um,
And
so
you think about it, just on that, if you think about it, someone that went to school 20, 30 years ago, the clinical area has changed massively, and their ability to keep up with the science and all the things that are going on, it is very difficult. I mean, it's very difficult. So even if you are a specialist in that area, and that's why you have subspecialties of subspecialties, is because it's become so technical. And so this is not only a tool for the primary care, I think it's a tool for specialists in the particular area because the specificity around the area becomes more and more refined as a result of just technology. I mean, as a result of the advancements of care, and the ability to keep up with it is very difficult. And I think AI has that. I think for primary care, it's at one level, but I think it's also the same one in specialty. So I wouldn't. I think the all the disciplines in healthcare are just going to be better as a result of AI.
especially with, new ways that DNA can alter
Yeah.
drug interactions, and
Oh my
there's
gosh.
a way to
Yeah.
memorize all that from a patient chart. It's
Yeah.
impossible. Then you
Yeah.
can
Yeah.
microdose different ways
Yeah.
that
Yeah.
to, and
Yeah.
that leads to personalized medicine. So I did want to ask you, looking back on your leadership through major national reforms and crises, and what advice would you give students and young professionals watching this podcast about building judgment to lead effectively in healthcare policy?
Um, I would say first thing you have to have a beacon.
Mhm.
You have to have a direction, a purpose, whatever you want to call it. But it's easy to get, it's easy to get to make a decision when it's in the moment and there's no context of really where you want to go. And I just find, and this, I mean, I deal with this personally all the time. Of you're in the heat of the moment. What's the right decision? And the decision I always come back to is, well, what is serving my purpose? Why am I here? Kind of thing. I know many times as a CEO, I faced that. And sometimes I will tell you, I wasn't proud of my decision because it didn't go with my purpose. And I always regretted that. I always regretted not speaking up and saying, this is the way we need to go. The second thing in today's world, especially leading with humility and curiosity. The world changes so quickly, and what we're dealing with today, we just had an AI conversation we just had about how much the clinical world has changed over the years, and then you can multiply that by every part of your life. And what you learn today is not necessarily going to be what it is tomorrow.
Mhm.
And the only way you can deal with that is to be able to have the humility to say, I don't know, and have the curiosity to be able to solve that I don't know through being able to research, ask questions, be actively involved and continuing to learn. And I find when you're learning, for me, it's just an exciting part of my life, but it's
Mhm.
an important part, and you have to go in there with a growth mindset. The third thing I would say is that I found is that spending time at the front line. I always learned so much when I would do rounds with clinicians or go into someone's home or listen to a phone call on our service center, because you really get to the ground and see it. And then I could interpret what the culture of the department was. I could interpret what the problem was. I could interpret where it is. And I could sit in a conference room and listen to all kinds of presentations, and I would know more by going out and seeing it. A classic example was I made a trip in a home with a nurse, and I remember she didn't know who I was, and the nurse was going through the visit, and at the end I asked, "What can we do for you?" And the individual said, "I'm lonely." And that to me was a great example of just learning something that's so important about aging. I asked that same question. This was in a very under-resourced area in North Miami. I went to uh, South Miami and on one of the islands there, and I went into this high rise that was just an amazing place. And the lady had a 24-hour um, caregiver, And I asked the same question. Her answer was the same.
Wow. Wow.
And I say that because that's an example where I would have never had that appreciation. And as a leader, and as you gain more and more responsibility, you get farther and farther away from where it's happening. And being able to spend time at the front line and being able to do it is both from, excuse me, motivating for me, but then secondarily, it's a great learning opportunity. The third thing I would say is don't go with the Big Bang Theory. I would go with test and learn and just take things iteratively, especially in today's world where everything is so uncertain and you can learn through the process. And I just found patience, a little smaller steps to the direction and the beacon you want to go. And then the last thing I would say is, there's clouds, and I wouldn't judge the day or the circumstance based on the number of clouds out there. If you have a true belief and that belief is aligned with what you want to get accomplished, it will come true. Might take longer than you want, might take more money than you want. It might take, you might not be in the same direction that you thought it was going to be. But if you're passionate enough about it, you'll accomplish it. You just have to be persistent and have the patience.
Wow. That is incredible. Incredible advice. I really appreciate that. And before and that's just the power of manifesting too. Just
Mhm.
manifesting a vision for your organization and being
That's
able
right.
to
Yeah.
lead through
Yeah.
that vision
Yeah.
and not simply telling people what to do, but listening. It's really a
Yeah.
beautiful reflex to have.
Yeah.
Is
Just on that, when I became um, CEO of Humana, the my first few weeks at Humana, I wrote down on a card the four P's: patience, persistency, passion, and Pepto-Bismol. And my point of all that is having those and being able to have that mindset that you got to have a little patience, you got to have passion, as you said, that you where you want to go. You need to be persistent, and some days you'll get a stomachache kind of thing. But the ability to really push through things is an important part of it's both leadership, but it's also an important part of just being a person that really wants to drive impact.
resilient leaders build resilient organizations.
That's great. That's a great way to say it.
Absolutely. We're we're rounding out right now. I want
Mm.
to be respectful of your time as well. I I mean, is there any final thing you'd like to tell our viewers, our audience?
I'm sure you have a very diverse audience here, so I don't have any advice for one group. I would say a few things. I think the healthcare system today, going back to the core of the podcast, is really a fascinating industry, and it's accomplished so much. You look at our longevity that we have today, our understanding of the human body, our ability to treat and you mentioned personalized medicine is a great example of that. Our the Just the surgical capability that we have as a country and in the world today, and just the impact it's had on our lives and on mortality. So I find that our advancements in healthcare have been wonderful. I think the thing we need to work on is the system itself and the ability to put more accountability in it and move it to a prevention oriented mindset, the ability to orient it to really making it simpler for the individual through not the complexity, and use technology to do that. That also it makes it simpler for the clinicians like yourself to be able to really do what they want to do, and that's to take care of people.
Mhm. Absolutely. Thank you so much for sharing that. And with that, uh, thank you for joining this incredible podcast. You alone have elevated this. Just in terms of the presence that it'll have at Georgetown's campus as well. People, who unfortunately weren't able to come to your Georgetown business event earlier, we can now enjoy all of your amazing insights virtually as well. So thank you
Well,
so much.
great. Well, thank you for having me. Thank you.
Yes, of course. And this is Cameron Savitt from Cutting to the Case signing off. Thank you.